Issues of health and access to health care remain a priority for all of us, especially as Californians work to recover from an especially challenging past year. Covered California is a free service from the state of California that connects Californians with brand name health insurance. And joining us today is Covered Californians Kelly Green to talk about the opportunity they offer to help bring the cost of coverage within reach for all Californians. Welcome, Kelly.
Thank you. Thanks for having me.
So yeah, insurance, always a hot topic, health coverage. How are people able to receive health insurance at low costs with your service?
Yeah, absolutely. So thank you, Aubrey. Well, if there's one thing that the pandemic has taught us, it's the value of our health. And health insurance is critical to making sure that people can access care when they need it. Right now, there are about 700,000 Californians that are getting quality name brand coverage through Covered California for $1 a month. And we have many more who are saving hundreds of dollars a month on their health insurance through Covered California. And this is a result of the American Rescue Plan, which is a new federal law that provides new and generous financial help that dramatically lowers the cost of coverage for people who buy insurance through Covered California. Right now, the American Rescue Plan is making health coverage more affordable than ever before for more Californians than ever before. It's helping them save hundreds of dollars every single month, put that money right back in their pockets, and we want to make sure that everybody knows about it.
Well, you talk about some of the extra financial help because obviously that's a big factor when people are looking for health insurance coverage. And, you say name brand. So it's not like they're stuck with one healthcare provider. You have a choice.
That's exactly right. And in the Sacramento region, so Sacramento, Stockton, Modesto area, consumers have brand name health insurance companies to choose from: Blue Shield, Kaiser, Health Net, Western Health Advantage. When you come to Covered California, these plans are available to you. The difference in working with Covered California is that Covered California is the only place where you can get financial help that we are talking about today to reduce the cost of your coverage. And as I mentioned, with the American Rescue Plan, we have Covered California consumers who are enrolled in these name brand plans that are getting coverage for as little as $1 a month, and others who are saving hundreds. So we really encourage consumers to come to Covered California, check out their options, see what financial help is available to them. I'll also add that there are consumers who are currently buying their coverage directly from these health insurance companies. These are consumers that have coverage today, but they're paying for the full price of that coverage without any financial help. Under the American Rescue Plan, which broadened financial help opportunities across the state and across the country, these are Californians that we want to make sure have awareness about the financial help available to them. They can come to Covered California, they can switch to Covered California, get those savings, and very importantly, most of them, the vast majority, will be able to keep their same plan: Blue Shield, Kaiser, Health Net, Western Health Advantage. If you're enrolled directly with them today, you can switch to Covered California, keep your plan, and benefit from the savings that are available to you.
Kelly, during the past year, many people may have lost their job, or they may have switched jobs, and that may have affected their health coverage. When we talk about the Sacramento region, how many people are being affected?
Absolutely. So the financial help is really important as we continue to recover from the pandemic and as people get back on their feet. We know that there are about 2.5 million Californians that could benefit from this new financial help under the American Rescue Plan. In the Sacramento region alone, 272,000 people. Of those, 85,000 in the Sacramento region are uninsured right now. They don't have coverage. They could come to Covered California, see what financial help is available to them, and they'll see that premiums are lower than ever before. We're really working hard to reach those who don't have coverage today, who need it, to know that now is the time to enroll. We also have, speaking of the consumers who are enrolled directly with their carriers, about 20,000 are currently buying directly from those health insurance carriers that I mentioned. Those are people who can switch to Covered California, keep their plan, and again, save hundreds of dollars every month. We don't want anyone leaving any money on the table.
And when you talk about enrollment, is it available at any time, or is it just a certain period where you can enroll?
Yes, so right now we are in what is called a special enrollment period, which means Covered California's doors are open. And we have been open, particularly in light of the pandemic, to make sure that everyone has the opportunity to enroll and to get the coverage that they need. And now with the American Rescue Plan, that all of those individuals who need coverage can get the financial help that's available to them. There are, we are encouraging people to enroll as soon as they can. Consumers who enroll by the end of this month, July 31st, could see their coverage take effect as early as August 1st. So we are really encouraging people to come in through our special enrollment period, which is happening now, and enroll as quickly as they can to maximize their savings and get coverage
All
soon.
right, great information. If you want to learn more on these affordable health care options, visit coveredca.com.